My name is Idon Lamage. The research I have been doing is exploring the pathopsychology and therapeutic approaches in Parkinson's disease. This disease has affected many older than younger people or throughout their lives. I am here to show you this disease and what it contains of and why it is so deadly, and hopefully in the future come up with a cure, which may be impossible because of many gaps in between. These few articles have helped me bring you some information and why we should care about people's diseases and help the world. This program will allow me to do these things I've always dreamed about doing, and being in this program will allow me to look at different medical diseases and one day put this program to use with getting into the medical field, as it's always been a dream of mine since a little girl. This is the table of contents where all the information spoken in this video will be talked about. Unraveling Parkinson's, more than just the shakes. Every 6 minutes, someone is diagnosed with Parkinson's disease. But what if we could predict who's at risk before symptoms even begin? This research aims to uncover the hidden interaction fueling this neurodegenerative storm. A quick overview on Parkinson's disease reflects from complex interactions between genetics and environmental. Specific mutations like LRRK2 and DJ1 combined with toxins exposure may accelerate onset. Our studies highlights a strong correlation between these factors and earlier symptom development. Future efforts should aim at personalized risk screening and targeted prevention strategies. Understanding both nature and nurture is key to unlocking better outcomes for those at risk of PD. The introduction on Parkinson's disease is a prevalent neurodegenerative disorder characterized by the progressive loss of dopaminergic neurons in the substantial nigra, leading to motor and non-motor symptoms. Understanding its multifaceted etiology, which includes genetic, environmental, and epigenetic factors, is crucial for developing effective interventions. On the left is the motor systems, and on the right is the non-motor symptoms. A question that's been asked is what's being done. The most common treatment in the use of medications like levodopa, which helps replenish dopamine levels in the brain. Second, physical therapy like rehabilitation services, including physical therapy and occupational therapy, help improve mobility, balance, and daily living styles. Surgical treatments, in some cases like deep brain stimulation, known as DBS, is used. This involves implanting electrodes in specific areas of the brain to help regulate abnormal signs. Research and clinical trials. Ongoing research is focused on understanding the disease better and developing new treatments. So lastly, supportive therapies. Support groups and lifestyle changes can also play a significant role in managing symptoms and improving quality of life. Here are some key factors on the Parkinson's disease. Genetic factors. Genetic risk factors for Parkinson's disease. Parkinson's disease has a multifactorial genesis, and although only about 10% of patients have a family history, at least 30% of the risk of PD developing depends on genetic factors, which differ in strength and allelic frequencies. Environmental factors. Scientists are trying to better understand the exposure linked in Parkinson's disease, known as PD. Another key factor is pathopsychology, is primarily associated with the gradual loss of cells in the substantial nigra of the brain. This area is responsible for the production of dopamine. Dopamine is a chemical messenger that transmits signals between two regions of the brain to coordinate activity. The research question is, how do genetic mutations and environmental exposures interact to influence the arrival and progression of Parkinson's disease? The goal is to explain the combined effects of genetic predispositions and environmental factors on PD pathogenesis. We hypothesize that individuals with specific genetic mutations who are also exposed to environmental toxins exhibit an earlier arrival and more rapid progression of PD symptoms. These are the three major gaps that don't allow this disease to get into a cure. First one, understanding the cause. The exact cause of PD remains unclear. While genetic factors and environmental triggers are known to play a role, the interplay between these factors is not fully understood. Second, disease progression. Parkinson's disease progresses differently in each individual, and the mechanisms underlying this variety are not well understood yet. This lack of understanding makes it challenging to predict disease progression and tailor treatments effectively for each patient that contains this disease. Lastly, effective treatments current treatments primarily focus on managing symptoms rather than addressing the underlying disease process. While medications like levodopa can reduce symptoms, they do not conclude or reverse the progression of the disease. There is a need for research into disease-modifying therapies that can effectively slow down or stop the progression of Parkinson's disease. With the study design, a cohort study involving individuals diagnosed with Parkinson's disease. The frequency of causative genes in the early set patients, a family late onset patients, B with clinical diagnosis of Parkinson's disease. The data indicates a significant correlation between the presence of specific genetic mutations and increased sensitivity to environmental toxins, leading to an earlier onset of PD symptoms. Detailed statistical analysis is ongoing. These findings suggest that both genetic predispositions and environmental exposures play crucial roles in the pathogenesis of PD. Understanding their interaction could lead to more personalized prevention and treatment strategies. This study underscores the importance of considering both genetic and environmental factors in considering both genetic and environmental factors in Parkinson's disease research. Future studies should focus on identifying specific environmental exposures that interact with genetic mutations to accelerate disease progression. These are the resources that I use throughout all of my slideshow. These were the resources to provide the information needed on this topic. This study was supported by the National Institute of Neurological Disorders and Stroke, known as NINSD. Thank you so much for your time. I hope this slideshow gave you a glimpse of Parkinson's disease and explored the pathopsychology and therapeutic approaches in the disease. Goodbye.